Rahul Khosla, President Max Group, President NatHealth. See, I think the most fundamental platform that I would like to drive is to create a framework of proper engagement with the government, not on the basis of requests or wish lists, but on the basis of a business case, which makes sense to ensure that quality, access and affordability of healthcare is uniformly provided across India. NatHealth represents a unique collection of very diverse elements of the value chain for healthcare, and this is a very unique opportunity for us to represent what we can do in partnership and collaboration with the government to be able to progress the healthcare agenda. So far that engagement has been sporadic at best. I would like to create a much more holistic engagement and a much more comprehensive engagement, which is based on an intelligent analysis of the benefits of progressing and also the costs of not doing so. Well, we plan to make them a success with hard work and the knowledge and experience that we have of running a large network of hospitals. I think it starts with reiterating the values that we have in terms of providing excellence in both clinical as well as service-related outcomes, hiring the very best that India has to offer by way of doctors, clinicians, paramedical forces, nurses and so on. And then, of course, going through all the rigor that it takes to ensure that the hospitals that we've acquired are embedded with the very best practices, the very best protocols, the ability for us to have the very best of equipment in terms of cutting edge and leading edge technology, and all of these components which make sense from a management perspective to make these successful. So we have a lot of experience in running tertiary quaternary care in our hospitals, and this is an area where we would like to also specialize to make sure that these new acquisitions embrace that philosophy. So Max Healthcare has always been on the forefront of technology. We were one of the pioneers, for example, in the health records, medical health records system, which we invested in 5 or 6 years ago, and which is now functioning in our hospitals. All of our equipment is cutting edge, and we make it a point to make sure that we refresh this equipment and all the devices that we use periodically to make sure that we're abreast of all the efficiencies and the accuracy and the effectiveness that it can be deployed for. In addition, we also have a network of hospitals which we manage through sharing resources and practices. So for example, we have a virtual tumor board for cancer patients where each one of our 13 or 14 hospitals, the doctors there can actually collaborate across a virtual system and decide on the pathways for patient care depending upon people's opinions and experiences. And therefore, that's another way for technology to bring expertise together. Another very interesting example is how, let's say, for example, in Punjab, we are successfully doing outreach in terms of providing care to villages and which are quite distant from our hospital by way of virtual connectivity, and how we can actually deliver outpatient care or even remote care through these means of technology. Last not least, the investments that we make in our equipment, in our infrastructure has always been top class, and that is something which contributes very enormously to patient care. Our future plans is to make Max Healthcare the epitome of patient care, and I think you will see this network growing both in terms of capacity as well as in terms of reputation, and really work very hard to be able to provide an exemplary level of care and patient care for our customers.